Hi, I'm Dr. Amy Kritzer. I am a clinical geneticist and medical biochemical geneticist, and I work with children and families who have rare genetic disorders, both for diagnostic evaluations, but also for long-term management and care coordination. I have had the pleasure to work with Dr. Catherine Nowak from the Feingold Center and have gotten to collaborate with her and the Genesis Foundation in determining how we best serve patients and their families when there is a complex medical condition in the family. Certainly, we are finding ourselves in very unique times. The current COVID-19 pandemic has really made us all have to think a little bit outside the box in terms of how we continue to support children and families. Many of our patients and their families are finding themselves in a pretty scary predicament, worried not only about their own health, their children's health, but also the health of their communities. And what we are finding is that now more than ever, the ability to connect with their medical care providers to maintain that level of support and connection and care coordination is really essential. At a time where our traditional systems are changing and how we provide care is in ever state of flux, the ability to know that your providers, the doctors that you have relied on to diagnose and treat your children, are still going to be there, picking up their phones, answering their emails, and having the ability to connect with you has been really essential. And as we've transitioned to a telehealth model to be able to continue to take care of our patients, what's becoming ever more apparent is that the need for care coordination, the ability to help families navigate the healthcare system, seek out new referrals, seek out new providers and evaluations is really important. And the work that the Genesis Foundation does along with the Feingold Center is really a wonderful model on how to do this well. Once a diagnosis is made, how do we support you as you navigate life? How do we learn from everybody that we meet to be able to share that knowledge with the next family that comes along? Families are often the greatest source of information. It's the tricks that they've found. And often what we're really trying to do is to build a toolbox so that every family has that box that they can go to when they're having a tough day. And the Feingold Center is what's giving people that box to put all those tools in and then supporting them as they're filling that box up. And since rare disease is by nature rare, often families are very much in this by themselves. And for many families, having someone that they can turn to who gets it, having physicians that they don't have to explain their child's condition to, that's what the Feingold Center brings to these families. Knowing that they are seen, that they are heard, knowing that whatever their child needs, that they're going to get an answer that is looking for solutions is what they bring to the table. And that's really important because we are all learning in rare disease. No one knows everything. And one of the most important things that we can say is, I don't have the answer to that right now, but I'm going to find out for you. And the ability to do care coordination is so essential in that because often it's not what I do for you when you're sitting in front of me. It's all the things that I need to continue to do once you're outside. And the Feingold Center, with its model for care coordination, is really able to do that in a very comprehensive manner. And they're able to continue to provide families that ongoing support once they've walked out that office door. Healthcare needs to be comprehensive. Healthcare needs to be all-encompassing. It isn't just, as I mentioned before, your medical treatment. It's how you live with disease. It's how your families live with chronic disease. It's how parents parent. It is how you get through every day. And as the mother of four myself, some days are easy, some days aren't. And it's being able to support families at whatever moment they're in, at whatever point they're in. And during this current COVID-19 pandemic, many families are finding that it really is moment to moment. That although they felt stressed and often isolated before this, they're now even more so with the loss of all their supports. And so now more than ever, it's important that we all band together as a community of rare disease providers, patients, families, to support them, to support the Genesis Foundation and the work that they do, to remind families that we are all in this together, that we are all going to continue to never stop searching for the next best thing for your child. And that really is a mantra to live by, is that as a community, we can always do more. As a community, we can always support people better. And as a community, we can always say that good isn't good enough, that we can do better. And through every child that we interact with, through every child that we engage with, we get better. Every family who shares their experience makes me a better physician. Every mother who shares the challenges of their day makes me better at what I do. I draw on my experiences as a mother of 4 kiddos to be a better physician, and I draw on the experience of other parents to be a better physician. And the work that the Genesis Foundation does, whether it's through its therapeutic programs, through recognizing the importance of music therapy, of animal therapy, of recognizing that healing comes in many different forms. Healing comes in the form of one-on-one therapies. Healing comes in the form of medications sometimes. Healing comes in the form of listening and being heard. And healing comes in the form of knowing that there are others who will continue to search for the next step. So I hope that everyone will join me in supporting the Genesis Foundation. Many organizations, many wonderful organizations are finding they are also in challenging times now with the loss of annual fundraisers and their traditional methods to raise money to continue to do the work that they do. And as we all are adapting, they have also learned to adapt to use the virtual platforms that are available to everyone to continue to do this work. And I hope that you will also join in supporting them and supporting your child's physicians and care providers so that we can all provide the care that you've come to expect, the care that you deserve, the care that your children deserve. And that despite the fact that we are in unprecedented and challenging times, that the one thing that will remain constant is the support of your community, the support of your physicians, your counselors, your teachers, and that knowing that we are all here for you and that we will do everything that we possibly can to get our communities through this. Thank you so much for your time and have a wonderful day.